You're muted.
Can everyone see those slides?
Yeah.
Did you want to do the introduction?
Yeah, that's fine.
Whenever you're ready.
Okay, did you start the recording?
Yeah.
Okay. All right, welcome. Our topic is on the importance of social support for exercise adherence. And we're going to dive into some of the research topics we looked at involving that. So some background on that is that one of the main reasons people begin exercising is because they're able to have that social interaction with others. And I think that that's something that's really important in exercise adherence, which is why we chose this topic. Exercise provides an opportunity to meet others, which can lead to the development of new relationships, whether they be in any aspect, professional, friendship, or an intimate relationship. Almost 90% of exercise program participants prefer to exercise with a partner or group, which is obviously a very large number, and it's something that brings people together. And recently, social support has been found to consistently increase exercise behavior.
My topic was, does attending an exercise class with a spouse improve long-term exercise adherence among people aged 65 years and older? So the purpose of this study was to measure exercise adherence of couples and non-couple groups. In this study, couple groups are defined as those who are both going through this process together, and the non-couple groups are not necessarily unmarried, but they're going through this as individuals. And they were given no prompts to socially support each other, while the couples were prompted to socially support each other. And despite all the benefits to your physical health, your mental health that we know of, 50% of older Japanese adults do not exercise, and of those who do exercise, 50% do not adhere. So because of these poor adherence rates, it's important to utilize effective adherence strategies to see higher rates of adherence. And previous studies have shown that there's a positive correlation between exercise adherence and marital status, which what this means is if you're married, you are more likely to adhere to exercise if you start a program. The hypothesis of the study was that those who participate in it with a spouse will maintain a higher adherence rate than those who go through this intervention as an individual. And this is simply due to the social support that they are able to offer each other and to encourage and motivate each other. And the methodology of this study, it was a non-randomized controlled intervention. It included a sample size of 34 married couples, 59 non-couples, and the inclusion criteria were those who were 65 or older, had no disabilities, and are currently non-active. And I use this term non-active to mean those who are not necessarily sedentary, but just don't meet the ACSM exercise guidelines. So for example, if somebody already exercises previously 150 minutes per week at moderate intensity, they would not be included in this study. And initially, this started out as an 8-week supervised exercise program. There was a fitness instructor, and they showed up twice a week. There was 20-minute sessions of walking 2 times per week, and also 2 times per week was strength training. It was 6 body parts and 2 sets for each at a rate of perceived exertion right about 13, so keeping the intensity at roughly moderate. And then after that was the continued exercise program, the same as during the 8-week, except it was unsupervised. And the exercise was kept track through an exercise journal. So the participants were supposed to record all the activity that they did or did not do every day. And then finally, there was a follow-up questionnaire about the social support that each group or individual received. the results of the study showed that there was much higher adherence rates, in fact 52%, 53% for the couple groups and 24% for the non-couple groups, and this is specifically for the walking adherence. Now, there was no significant difference for the two strength training groups, that 70% versus 80%. I'll explain in a minute why this study did not consider that to be a significance. And the couple groups indicated on the follow-up questionnaires that they received greater social support from their family compared to those who went into this program as an individual. And to discuss a little bit about this, my belief why there's an incongruence between the results of walking and the strength exercise adherence is simply the accessibility factor. In order to do the walking, you're going to have to go outside. So if it's a rainy day, if it's a hot day, especially older individuals will most likely be less apt to want to go outside.
Did it disconnect for anyone else, or was that just me?
Yeah, mine went out.
Okay, so it's still recording, and I think will be able to edit it out, but I think you ended at the incongruence, like between the walking.
I'd say just restart that slide, maybe.
Yep, sounds good. So to discuss the study a little bit, there was an incongruence between the results of the walking and the strength exercise adherence. And I explain this by the accessibility factor, because in order to do the walking, you have to leave your house, and especially for older individuals, that will serve as an inconvenience, and they may not want to go outside, especially if it's a hot day, if it's rainy. The environment plays a factor in this motivation. Whereas for the strength exercises, it's body weight, so you can do this at home from the comfort of your home. And I believe if the study was 10% larger, I apologize. If the study was larger, I believe the 10% difference for the strength training adherence that we saw between the couple and the non-couple groups would have been considered significant. It was simply because of a small sample size that this was not considered significant for this study. And the results from walking adherence match previous results from previous studies, which show, as I stated before, that there's a positive correlation between marital status and exercise adherence, which once again means if you're married, you're more likely to adhere to a program if you start it. Now some strengths and limitations. Strengths is this is the first study that was done which measured the effects of spousal social support on adherence for older couples over 6 months. Of course, there have been other studies done in this field related to this, but this was the first that took this specific approach and focus. And the study was 6 months in length, which is another strength because, as we know, 6 months is sort of like the magic number. If you've been adhering to a program for 6 months, you're very likely to continue to do so. So 6 months is a great time marker. And some limitations of this study, there could have been a more accurate measurement of exercise adherence because, as I had mentioned, they used exercise journals, which that's the individual writing down what they do. So results could be skewed. Maybe somebody forgot to write down a workout for the day. So I believe a better approach to this would have been to use a wearable device that would track the specific activity. And finally, I believe there could have been possible spousal support by non-couple groups that were not considered in the statistical analysis because the non-couple groups were just those who did this program as individuals, but they still could have been married at the same time and therefore still receive that spousal social support.
The article that I researched was called The Association Between Social Support and Physical Activity in Older Adults. With more people living longer and longer, it has become even more important to encourage healthy aging. Healthy aging can include a variety of things, including diet, but a main component is physical activity. This is because physical activity reduces all-cause mortality and helps prevent any chronic illnesses or many different chronic illnesses. However, with all of the benefits of physical activity, the actual amount of people active enough to get these health benefits is very low, and it decreases even further with age. It has been proven that social support is a determinant of health, and it improves physical activity in older adults. Therefore, the purpose of this study was to further examine this relationship and determine how social support influences exercise adherence in older adults. The overall hypothesis of this study was already known that social support increases exercise adherence, but they wanted to review the social support and physical activity and further examine this relationship and see the effects of it. So the first goal was to examine the association between social support, loneliness, and physical activity in older adults. The second was to find which types of social support are associated with physical activity. And the third goal was to investigate and research whether the association between social support and physical activity differs between different physical activity domains, so different types of physical activity. The methods included a variety of different factors, but the study was conducted in older adults and was found using a certain set of specific criteria. The first specific criteria involvement included having generally healthy, community-dwelling older adults with a mean age of at least 60 years old. The minimum age was no less than 50, and if the participants were not within the age range or if it messed up the mean, then those were extracted and excluded from the overall study. The second involved having a validated measure of social support with a validated measure of loneliness as well. The third involved measuring physical activity either objectively or subjectively using measures with established validity as reported in the individual papers. This means that the studies must be reliable and responsive to be included. So they had a series of questionnaires and papers that they took individually and they read them all and they figured out which ones were reliable and which ones were not reliable. And then they included those ones. The fourth including having peer-reviewed quantitative studies. So the studies were included from many different countries and had to be available in a variety of different languages in order to allow them to be referenced from a variety of different cultures. The quantitative studies involved allowed the researchers to look more closely at the relationship between social support and physical activity. All of the adults measured used some sort of different site or background that they based it upon, such as like Medline, Psych Info, Sport Discus, PubMed, and there were many more. So the quality of these studies and systems were also ranked based off of strength of study and relationship. The data was extracted by two certain reviewers that they chose based upon country where the study was conducted, study design, and sample size. The papers were then also rated later on by those two reviewers and by others based upon the risk of bias from the study, and they had a quality assessment which showed the flaws within each review to allow for a better understanding of the literature and a better correlation to be made. The results suggested that there is a positive relationship between social support and physical activity levels in older adults. This is especially true for when the social support comes from family members. They found a much higher correlation from family members as opposed to friends or exercise trainers or anyone else, which kind of goes along with the study before of showing that spousal support helps a lot more than any other type of support. The study also found that there was a much higher correlation between support from family members and from friends, and a higher correlation was also found between females and social support for adhering to exercise in leisure time. There was not as much of an association with men as there was with women, and I think that partially the reason that is because they had a lot more women in the study than men. So I think that is a possible limitation of the study because there were a lot more women than men that were a part of it. And the results showed that a total of 67% of the participants reported having a positive association between, like with friends, And then there was a much higher correlation, an 83% association to adherence rate from family members. So the results also showed a negative relationship between loneliness and exercise adherence. So this shows that people better adhere to exercise when they have support from others as opposed to exercising on their own. The study confirmed that there is moderate support, that the more social support someone has toward a physical activity, specifically from family. Can you hear me? Okay. The study confirmed that there is moderate support, that more social support toward physical activity, specifically from family, is associated with higher levels of physical activity or meeting the physical activity guidelines from the ACSM. This implies that older individuals with more social support are more likely to be physically active and therefore can age healthier and develop healthier lifestyles as they get older. Social support, specifically from family, shows an even higher correlation toward being active in general. It was also found that general social support in females from family and friends was consistently positively associated with leisure time physical activity. Social support and enjoyment have been found as two key reasons for participating in sport or leisure time physical activity in those of all ages. With having emotional support from others, it was found that intrinsic motivation for exercise was increased. This suggests that having more emotional support will result in more enjoyment from exercise, which in turn increases motivation and adherence rates. Social support can also help to improve self-efficacy in exercise as well, especially in women, which can also increase adherence rates long term. So therefore, the more motivation that people gain from exercise, the more likely they are to stick with it and adhere to it. The study had many strengths, which include having a variety of different study designs with a variety of different physical activity measures. So they based it off of a variety of different things. They didn't just include one variable, they included many different variables, which allowed for a broader understanding of the relationship between physical activity and social support. And then they also used something that they called the quality rating scale, which is a suitable scale for different designs, which allows the authors to draw different conclusions and make stronger assumptions between the different variables that were all included. However, there were also a whole bunch of strengths or weaknesses, I thought. Some of the limitations included the fact that only healthy older adults were included. This means that many older adults were excluded, which could greatly skew the results of the study, because many older adults do have chronic illnesses or impairments, and by excluding that, you're excluding a large percentage of the population. So I think that that should have been included in the study. And then there's also an inconsistency in the measurement of social support because they included so many variables. So I thought that could be seen as a strength and a weakness. Because they included so many variables, they couldn't focus just on one thing. They focused on too many things. And they had too many different scales being used, and only one study used the original scale that they wanted to use, which was developed by Salas et al.
Okay, I found a study that focused on the perceived social support, specifically from their physician, and physical activity among patients with coronary artery disease. So the purpose of this study was to find out how they can get patients with coronary arteries to stick to an exercise program. We know that exercise is one of the most important treatment options and prevention options for coronary artery disease. The researchers already knew that social support was a big factor in exercise adherence, and the social support coming from family members and friends, but they wanted to discover how a physician's social support affected exercise adherence. So the hypothesis was that social support from the patient's physicians would increase exercise adherence in those suffering from coronary artery disease. But they also thought that self-efficacy would play a role in perceived support from healthcare providers. So basically, if they thought that if they had their social support from the physician, then they believe that they would be able to complete exercise programs. So methodology, they did a convenience sample, so people of all ages, different genders, different backgrounds, of 257 coronary artery disease patients were taken from a clinic in Korea. They surveyed their physical activity levels, their exercise adherence, and their self-reported self-efficacy. They did the physical activity levels by using the International Physical Activity Questionnaire in Korean. They use this because it was already proven to be very reliable and valid in other studies and encompassed a wide variety of things. So it included frequency, how often, how many times a week they were exercising, the duration of their exercise, whether it be like 10 minutes or an hour, and the intensity. So it went from low intensity to severe intensity. They also surveyed perceived social support using healthcare climate questionnaire. So this is a 15-question questionnaire. It scales from 1 to 7, 1 being not true at all to 7 being very, or like strongly agree. Questions they asked was, I am able to be open with my physician at our meetings. I feel understood by my physician. I feel that my physician has provided me choices and options. And then they also surveyed their self-efficacy. So they asked everyone, do you feel like you can tolerate physical activity after your cardiac event or after your diagnosis? The results showed that social support from the physician was definitely one of the strongest predictors in physical activity levels. Self-efficacy kind of correlated in with that, as you can kind of see in the chart, that perceived social support increased self-efficacy, which then therefore increased physical activity levels. So we know that social support from friends and family is important, but this study helped to prove that the healthcare providers also need to make sure they are taking time to ensure that their patients know that they have their support in their physical activity plan. They need to talk to them about what they can and cannot do to provide that self-efficacy aspect to it. A good idea would be for them to check in with their patients and help them create an exercise plan. And then it's also important for them to discover how their patients feel best supported, whether that's like having longer conversations with them, asking them about future visits, like remembering stuff like that. There are different ways. So strengths and weaknesses. The study did study a large group of people, and it did include men, it included women, it included different age groups, different backgrounds. And they did use surveys that previously proved reliance and validity to ensure that people couldn't just like lie and fill out the forms real quick just to get it done. And then they also clarified on how self-efficacy would affect results. And I think that was important because that definitely did play a major factor into whether or not people were exercising. So weaknesses, the self-reporting, even though they did prove to be reliable, people could still lie. They could just try and figure out, I have this thing saying wasting time. And it also did not explain how the healthcare provider can provide that social support to their patients.
Okay, so I had social support in its relationship to physical activity in young adults. So the purpose of this study was to determine if inactivity at a young age can lead to issues such as heart problems, heart risks, failure, or any other health concerns. They want to try to understand if social support is the main way to encourage young children and adults to become more active in fun, engaging, and other social ways. They also wanted to recognize and help combat the increasing rate of obesity in young adults. The hypothesis of this study researchers hypothesized that more support from family members, whether that was older or younger members, could dramatically increase the rate and percentage of young adults who engage in physical activity and exercise. As a result of this encouragement in exercise, researchers wanted to help prove that young adults would then become more healthier and they would be less likely to develop any health issues later on in life. So as a part of this study, they had one biracial sample of middle-class male and female teachers. The mean age was about 38 years. And another study also involved a sample of lower to middle class males and females so that they could compare possible job reasons for not working out or income reasons for not working out, because we all know people who make more money are more likely to work out because they have more time. In this study, researchers wanted to examine how social support scales influence this group of men and women. They also wanted to analyze how social support in a busy life would translate to engaging in physical activity. So if people had a busier work schedule, would they be more or less likely to engage in physical activity in their free time? And if their family would support them in that free time, which would allow them to exercise. And they wanted to measure if there would be immediate or long-term health benefits of physical activity, and these could have been acute or chronic in the moment. So in both studies, social support scales had high internal consistency and a two-component solution identical to the original study, which means that social support for exercise was positively correlated with physical activity. So with more support, these men and women in these studies were able to do more exercise, and this was not influenced by race, gender, or this specific type of support. As long as these people had support, they were engaging in more activity. So for example, if a teacher, one of the teachers in the study came home from work and had their children, the partner in this study would therefore watch the children and the spouse would go engage in physical activity. In both studies, the overall leisure time women have was positively related to family support. So women needed more support from their family, and which would give them more time. African American women tended to need familial support as well, and white men and black men both tended to need friend support and a little bit of familial support with exercising. And this study shows how important it is that we support young adults and how they choose to be physically active. And in one of their busiest times of life, it is very important that we give them family support and friend support so that they can help develop healthy exercise habits. And with this study, when there was more support from family and friends, participants' self-confidence and exercise adherence dramatically increased. And some strengths of the study was that it studied a big group of men and women that ranged in age. So it didn't really look at just young, very young children. It looked at people who were in their 30s all the way to their 40s, but still relatively young. It took a very direct approach in asking the patients to self-analyze how they felt following the exercise. And these patients would analyze themselves before a program and after a program, and then they did it before and after the entire study, so it could be more direct in the results. Some weaknesses was that they only used 2 control groups out of the 8 groups that they had within this study, and it didn't really give them any answers because the control groups were not really told what to do or what exercises to do. And the exercise methods and support methods varied from participant to participant, so there wasn't really any direct one type of support that was proven to be most useful.
This study was conducted in Spain in order to test the self-efficacy and adherence to treatment and the mediating effects of social support. The research was done before the study, and it found that in order to maintain a higher quality of life, it was important for patients to understand and maintain their daily treatments and exercise. Patient self-efficacy is directly related to treatment adherence. With a higher perceived amount of self-efficacy, patients were more likely to adhere to their treatment regimen, including their diet and exercise. This study was used to research the effects of social support on the relationships between self-efficacy and the exercise adherence and treatments. It helps to provide a deeper understanding to the processes that relate to this relationship, exercise adherence, and perceived self-efficacy by means of social support in chronic patient groups. The researchers predicted that self-efficacy would be positively correlated with social support and negatively correlated with non-adherence to treatments, which include diet, exercise, and medication. They came to this conclusion based off of previous research done in the relationship between self-efficacy, treatment adherence, and social support, which the relationship is seen below in the figure. They completed their study by having 202 chronic patients from Spain, ages 21 to 65, and 68% were female and 32% were male. Each of the patients had one of the following chronic diseases, either hypertension, dyslipidemia, diabetes, or COPD. They had stratified random sampling that they selected patients, and they had them attend their usual health center and then where they discussed the study and had about a 2-hour interview where they used modified scales based off of self-efficacy, social support, and non-adherence to treatment. For self-efficacy, they used a version of the chronic pain scale, ranging responses from 1 of completely unable to 5 of completely able. The researchers used the scale to ask participants to rate their ability to manage different tasks. So the higher they scored, the more positively correlated it was with self-efficacy. For social support, they used the perceived social support specific to the illness questionnaire. It had 3 20-item subscales that related to the family, friends, and partners. This took into account the positive and negative support patients felt from the sources listed above. The responses had a range from 1 of never and 5 to always. Some of the examples would be, did you feel listened to, if they made them feel something positive, if they contributed to others, or if the family member did small favors for them. In the non-adherence to treatment, they used the Haynes-Sackett test, and it was adapted to fit the study by focusing on medication, exercise, and the diet plan. They used responses and the diet plan recommended by the doctor, and they left open-ended responses to see if they had ever forgotten to take their meds or not follow their diet plan or exercise plan. In the results, it showed that self-efficacy was positively associated with social support, so the patients had more perceived control over their health with more perceived social support. And self-efficacy was negatively correlated with non-adherence to physical exercise in the last 7 days of their treatment, which shows that as patients felt more self-efficacy, they were more likely to adhere to physical exercise in the last 7 days. This study shows that it's important to have knowledge, to have social backing when it comes to a chronic illness. Without the social support, patients felt their self-efficacy was lower, which means their overall quality of life decreased because they weren't completing their treatment plans. Within these treatment plans, exercise was the biggest thing patients adhered to when they had social support, showing that in order for patients to stay on top of their physical activity regimen, they should have social support system backing them in order to keep up their control and health plans. In the strengths, it used patients with chronic illnesses, which I think was a very strong thing considering most of these studies used a lot of healthy adults, and this showed that social support is very important when fighting against a lifelong fight in different illnesses and not just focusing on the healthy adults. For the different chronic illnesses and a large age range, that was a positive because it gave variety to show that it can affect people of all ages and with all different diseases, and they can all be going through the same thing. On the other hand, this was a very large age range from 21 to 65, so it didn't really give an opportunity to show how much it affected the older versus the younger generation, and it could have skewed the results if more social support affected one group over the other.
All right, so for my research topic, I found a research article about key factors associated with the adherence to physical exercise in patients with chronic diseases and older adults. So the purpose of this study was to look at ways to improve exercise adherence in the chronically ill and elderly by looking at many different research articles that have already been published. They use these to find factors that are most influential in exercise adherence to find like the most important set of key factors that showed commonality between all of the research articles. They use this to determine the influence of social support in the creation of outside and home-based exercise intervention routines. And they link the connection between social support and relatedness as an effective measure for adherence, which I will get into in the following slides. So their hypothesis of this research study was that there would be multiple variables that factor into exercise adherence, and that they would be they could be controlled and modified by the researchers or professionals to predict results. The variables in this study would have different weight and importance in maintaining adherence, and the synthesized research would show trend lines towards the most valued variables. This is shown in the research where they found correlation with some values having a much higher occurrence than others, and that's how they created their 14 key values in the study. For the methodology, the study used PRISMA guidelines, which is the preferred reporting items for systematic reviews and meta-analyses. This is a way to effectively collect research safely to make sure that it's validated and peer-reviewed. And using these guidelines, they found 55 articles that fit the specifications. And with those 55 articles, they were able to narrow it down to 14 key factors that went into helping with exercise adherence. To become a key factor, that factor had to be mentioned in at least 10 of the 55 articles, with many of them being listed in much more than that. These key factors were further analyzed to determine their strength, relevance, and role in exercise adherence. And I specifically looked at more of the information that had to do with the social support factor, because that's what pertained to our topic. So looking at the elements of social support was vital for it to be effective. And the biggest populations that were included in the study were cancer patients, cardiovascular disease, older adults, and musculoskeletal disorders. These populations were determined by what came up the most often in the 55 research articles that were used in the study. For the results of the study, it was found that social support was a key factor in exercise adherence, and it occurred in 22 of the 55 research articles, which showed pretty high positive correlation in the improvement of exercise adherence. Among this, it showed that there was a close link between social support and relatedness, and that was brought up in 10 of the articles. And basically what relatedness is it has to do more with self-efficacy, but it's the value and meaning that a person has in that group. And they found that actually is like in tandem with social support, and it's just as important and needs to be a factor for social support to be effective in exercise adherence. Negative social support is linked to lower mental health, higher risk of developing certain diseases, lower life expectancy, lower physical activity levels, and more stress and poorer resilience. Controversially, positive social support increases optimism, self-esteem, and adherence. And the most important thing is not only does it provide positives, but it also decreases some of the negatives, such as depression and stress, which can actually lower levels of exercise adherence. So it shows the strength of social support because it increases the positives and decreases the negatives associated with continuing exercise. The final result was having an available exercise professional shows strong correlation to positively increasing both social support and relatedness. So the key takeaway from that is that if you want to improve exercise adherence, having an available exercise professional can be very valuable because it increases both of those very important key factors. For the discussion, the study has a positive perspective on finding key factors that improve exercise adherence in susceptible groups of people, such as the ones listed earlier. And social support is a positive that both increases adherence and decreases the likelihood of detrimental variables, which just goes to show its strength in improving adherence. Besides social support, initial exploration of participants' characteristics, barriers, and facilitators was the most prevalent factor in the study. It was found in 32 of the 55 research articles it took place, and so that was rated as the #1 key factor in the study. There are many variables that factor into both exercise adherence as well as social support, and the #1 being relevant or relatedness, which was talked about earlier. But going along with that, social support can be broken down into the different people that are helping you. Social support can be factored in from a familial standpoint, a friendship standpoint, and a mentor standpoint from the healthcare professionals and strength trainers that are helping you. Some strengths and limitations of the study. The strengths that were found were that the correlation of social support and adherence is very high in the articles that they selected, which just goes to prove the hypothesis is true. And the hypothesis was validated by these findings, in that all of the correlational research in the study backed up the hypothesis that there would be trend lines with the key factors that are involved in exercise adherence. The limitations involve relatedness, predicted social support effectiveness. So social support on its own isn't necessarily as effective as once thought. The people who are taking part in the exercise need to feel valued in the group and need to think that they have a role. Otherwise, it can actually be a negative if there's negative social support, and it can actually deter them from adhering to their exercise guidelines. Social support was not the largest key factor, which isn't a huge limitation to the study, but to our research that we're talking about here, it was still one of the top 5 factors for this study, but it was not the #1. And for our final limitation, since it was a research meta-analysis, the key factors are probable, but they're not guaranteed. And basically what this means is that the research synthesis looked at trend lines of what each article was referring to as factors to helping adhere to exercise. And that means that there's a higher likelihood that that's going to occur, but it's not guaranteed.
So applied implications. So from a healthcare perspective, we realize that it is very important that healthcare providers are not only making sure their patients have social support from their friends and family, but also that they are providing that social support themselves. And then we also found that whether a person was a beginner or whatever their fitness level was, that support groups were still beneficial. This was because you find people that are like you have that relatedness, one of like the core necessities that we talked about in class. And then it can also be like a support group for you to adhere to your exercise. So people encouraging you to like come to class or go for a run with them or whatever it is that people are doing. And then by placing young adults in an emotionally positive environment, we can encourage them to engage in exercise through positive rewards such as treating oneself. This takes a different perspective rather than exercise being viewed as a punishment. Instead, it's more of like self-care. Some examples of how this can be done is by advertising gym classes in workplaces and group treatment and PT and patient care facilities.
In order to piece all these studies together, the first major point is that all the studies, they looked at various populations, young, old, different races, different sexes, but they all showed that social support improves exercise adherence. And social support is strongly linked to self-efficacy. And this is simply because if people offer their support to you, they're showing that they believe in you, they have confidence in you. So in effect, you will then have confidence in your own ability to be able to continue with the exercise program. And in order to increase happiness, health, and willingness to exercise, it's important to keep a strong social group incorporated with your exercise routine. This is whether it can be a spouse or a friend or another family member, whatever works best for you. And exercise is shown to enhance people's views on their ability to control their health. This is simply because you're playing an active role in making your health better, so you clearly see that you have the ability to control your health. And social support is extremely for all age ranges. As we said before, it increases exercise adherence, but there is a much greater correlation between all the types of social support. The one with the greatest backing behind it is from a family member specifically.